This conference will now be recorded.
Yay. All right. So I thought I would do something a little different today. Now, I have in the past gone through the 10 rules. There are the first five are for both day programs and residential. Uh, Rules 6 through 9 are exclusively for residential. And then the 10th, which is accessibility, just the people can get to the program can and be able to utilize it fully, is number 10. So there are 10 rules, and but that's not. I'll cover them today, but I won't. That's not really the focus. What I'd like to do is get the big picture. The rules are how do you go about doing it. What I'd like to talk about is what it is and how we got to that, and what we're attempting to accomplish by home and community based waiver. Also, some of the challenges that we see with home and community based waiver, not the least of which is funding and some of the challenges. And we'll talk real briefly a little bit about that as well. Okay, let's go ahead and get this party started. All right. If you're on this webinar today and would like continuing education, you've probably seen this slide before. And this basically just explains what you need to do in order to get that continuing education credit. The credit is good for both Kern Regional Center and for community care licensing. So in order to do that, you got to attend the whole thing today. It'll probably go just a little bit under an hour and a half. You must identify yourself, so your names are on the screen right now. If there's more than one person uh, behind the screen at your end, you need to identify everyone who you would like to get continuing education for. So if you have a couple of people sitting in the room right now, we need to know who each of those people are if they want the credit. Um, one of the well, we do it for two reasons. One is that we want to make sure you do stay with us for the whole thing because we have a responsibility to Kern Regional Center and licensing to make sure that if we're giving credit, that you really deserve the credit. And two, because adult education works the best when you're actually taking notes or writing something down in terms of what you learned. So you'll get more out of this. And we also know that you actually did participate or were involved by completing a brief summary. It can be just bullet points, three topics. I don't want like full essay on three concepts or things that you learned today from this webinar. So, for example, the home and community-based waiver is part of the Medicaid program and was started in the early 1980s. 1 point. And then finally, and you want to send that to Irene at who is at Kern Regional Center. Valerie just put her information in the chat. She is the person who is the coordinator for this project, and she will make sure that you get credit timely. And we ask that you try to submit this within 30 days so that we can keep track of what's going on with these courses. So that being said, we'll move on. A couple of changes that are coming down the pike for this program. One is Relayus, which was the self-directed continuing education program that was part of this grant, will be ending at the end of this month. And Valerie, right now, who is on this webinar as well, is just finalizing everything, making sure everybody got their credits, and she's in the process of shutting it down now. So you are taking advantage of the Relayus program. You need to finish it up within the next week because we're now. Any comments on that, Valerie?
No, that sounds pretty accurate. I know that there's a few. I want to make sure that all the certificates are printed. So a few have already received emails from me that it's just like there's a questionnaire at the end. It's like 4 or 5 questions from most of them, and just asks you how well you enjoyed the training. So if you don't complete that, it won't generate their certificate. So I just want to make sure, in fairness, that everybody has everything that's accounted for. And then also I will be storing those. So if you need them, because we won't have access to the site after the 30th, I do have that information stored on my end. So email me at any time and I can send those over to you.
Okay, thank you. And then we have a change come October 1. Now, for the last probably 6 years or so, the Department of Developmental Services, the parent agency in Sacramento that runs all of the IDD programs, has put out grants every year to giving them to regional centers, and then the regional center decides on who in their community receive those to do home and community-based waiver services. I've been actively involved with that since the beginning. And so, both when I worked at Bakersfield ARC and then now as a consultant for ARC and for Positive Purposes, I've been doing them. And one of the things that I've done is I've encouraged other providers to apply for these grants. You can apply for them for a couple of different uh, things. You can do community training, which is what Bakersfield ARC is doing and Positive Purposes is also doing. Or you can look at how you're going to continue to do quality improvement of your own program. And it's things that you want to do internally. Say, for example, sending someone to the a certification for person-centered training, or other things you want to do, training for trainers within your own agency. You're making some of the changes to how you go about fully integrating and getting people to be part of the community, and you want to there some training for your direct support professionals. Anyway, so the long and the short of that is, in the last year, it was successful. More people have applied. And so the funds that were available to Bakersfield ARC and Positive Purposes, the two that I'm working for, were cut back this next year because we're sharing the wealth where more people are involved. And I think that's great. We want to make sure that as much enhancement in our community occurs as possible. So starting October 1st, there will only be one webinar a month. So what I will be doing for Bakersfield ARC will be, I will continue to be doing the newsletter. And if you're not receiving the monthly newsletter, that same email address that Valerie put into the chat, you can contact Irene and ask to be put on the mailing list, and you will get a email usually in the first week of the month with a newsletter. It has events that are things that are occurring in that month. It usually has a specific topic that it covers in regards to home and community-based waiver, and it also has updates, both what's going on here in California, what's going on at the national level, and I always look for free trainings that may be out there that you could take advantage of. So I will put that into the newsletter as well. So the newsletter will continue, and the once a month webinars, and unless something comes up with my schedule, I will attempt to do them on the third Wednesday of every month. And we will put that out at the beginning of the month in the newsletter. And then there'll be follow-ups, both from usually Leslie from Kern Regional Center and Irene from Bakersfield ARC send out reminders a day or two before the presentation on to help you think about attending. So stay
Jeff,
tuned.
just really quick, you did freeze up a little bit while you were talking, and it got a little pixelated. I don't know if you just wanted to shut off your camera.
Yeah, okay, I'll go ahead and shut off my camera. I was mentioning earlier, I'm having a little bit of a challenge today with it coming up saying that it's a poor connection. So by shutting off the camera, I won't be using as much bandwidth, and so hopefully that will do it. You can all still see the slide, right? Sorry.
That slide's good.
Okay. Okay, let's go ahead here. Okay. So today's agenda, we're going to introduction to the final rule, core principles of the HCBS final rules, requirements for settings providing the services, the impact on individuals, providers, and the system, and moving forward with implementation. So those are the sort of things that I'm going to be sharing with you today. And again, not so much the actual 10 rules, but more of an overview of what this system is about. Okay, so here we go with the introduction. Okay, in 1981, shortly after Ronald Reagan became the president of the United States, a family contacted him by mail, basically requesting him to look into the fact that their daughter had become ill to the point where she needed to be on a respirator. And if that respirator took place in a hospital setting, and there were some complications and some regulations that then at some point could allow it potentially to come home, but it was very complicated, it would be paid for. But if they did the respirator at home with supports from maybe nursing staff or other trained professionals, you couldn't get it paid for by Medicaid. Now, President Reagan looked at that and said, wait a minute, it seems like it would be more cost effective to have this service happening in the family home. And you've got the parents who love and care for this child, sort of overseeing it and being an integral part of the mix of providing the service. And doesn't that make more sense? So he instructed his finance people to look at putting this waiver into the budget. And then 2 years later, the Congress added what at the federal level is called 1915C, which is to the Medicaid and Social Security Act, giving states the option to receive a waiver for Medicaid rules for institutional care. So then initially the federal government was doing it on a very limited basis. 2 years later, they said, okay, states, you want to do this, you can apply to the federal government, and once your application is accepted, you can provide waiver services in your particular state. I remember I was back then in 1983, I was working at Kern Regional Center, and shortly thereafter, the state approached the 21 regional centers and said, hey, we've got this new little small program that's going to bring in some extra dollars to the state and it's going to allow us to serve more individuals in their own home, and we're going to get this thing started. And from being a very small little program initially, it has really mushroomed. In 2005, the home and community base became a formal Medicaid state option. So what they did was they made it an optional service. So states could decide they wanted to provide it, or states could say, no, this is not part of the Medicaid waiver services that we provide. Now, where this becomes important, and I can't tell you what's going to occur in the next few years, but so Medicaid waiver is an optional service. A state can decide they want to provide it, or a state can decide they don't want to provide Medicaid waiver services. Now, if some of you were around in 2008 or 2009, you may remember that for a few years, California did not provide dental services under Medi-Cal, and other services too, physical, OT, PT, some other services. And the reason for that was because the state was in some serious financial challenges, and those were optional services. So things like going to see the doctor, going to the emergency room, getting x-rays, those sort of things. That is a service that any state that's on the Medicaid program has to provide. But then there's a list of services that are up to the state, and they can provide them if they want, or they don't have to provide them. And so the home and community-based waiver services are one of those optional services. And some people in the advocacy community for IDD services believe that over the next few years, we're going to see many states cutting back on home and community-based waiver services because of the cutbacks that are going to be required under the new Budget Act that just passed in July. California has said that they're going to make a commitment to try to keep the service mix that we currently have, and will try to do everything they can. But who knows what the budget situation will be in California or anywhere else for that matter, and whether these services may take a reduction in the future is one of those unknowns. And I don't want to be a deliverer of pessimism because I don't know. But that is something that is being predicted by some of the advocates that serve this community. Currently, there are 47 states and the District of Columbia that are offering at least one waiver. So the waiver's not everywhere. There are 3 states that do not provide waiver services at all. And in many states, the waiver services are capped, so that the state has a certain number of people that they'll serve, or a certain dollar amount that the state's willing to kick in, because in many states, the reimbursement depends on the how financially solvent the state is, and so states that are wealthier get a 50-cent match from the federal government. So the state comes up with 50, the federal government comes up with 50. Some poorer states in the primarily in the South may have a reimbursement rate as high as 70 cents on a dollar of federal money. States implementing waivers are responsible for ensuring quality services and supports are available. The Center for Medicaid Services has oversight of the states to ensure this. So California is responsible for providing, to make sure that the services that are being provided under waiver are quality services. So when you had an assessment last year by either regional center staff or by staff from Positive Purposes, they were looking to see that you were providing services at the quality level that the federal government required. And California has to submit a plan to the federal government on how they're going to go about doing that. And in talking with Leslie, who's on this webinar today, and if you wanted to pipe in on this, Leslie, I'd love to have your input as well. She has shared that the department's going to be coming out shortly with a new set of guidelines on how to go about ongoing monitoring to make sure that we continue to strive for that excellence. So it wasn't just that everybody got evaluated in 2023 and 2024, and now everything's all right with the world. The federal government is saying, no, this has to be reviewed regularly. And California, as well as other states, DDS is working on a directive for 2026 for HCBS monitoring. So it's forthcoming, according to what Leslie is saying, and we should be seeing it shortly. And it will, once it comes out, I'm sure that the regional center will make you aware of what those requirements are. Okay.
Jeff, Leslie just put something in the chat for you.
What's that?
Leslie just put something in the chat for you.
I saw that. Okay, thank you. Okay, so here we are in 1984, and President Reagan visited the young lady who basically started this program. Her and her parents. President Ronald Reagan meets Katie Beckett, along with her parents, Julie and Mark Beckett, as the president exits Air Force One on the tarmac of Cedar Rapids Municipal Airport, Iowa, in September 20th of 1094 or 84, excuse me. So President Reagan had an affinity for this young lady, and really it started a major change in how we provided services. Now, the waiver was, okay, so here are people who need institutional level of care, like a hospital or a developmental center or something, and we're going to serve them in the community. Well, if you go and look at what happened since 1981, when this program started, the system has flipped. So now there are more individuals on waiver than there are in the institution. And I had a boss at one time who said, wait a minute, maybe we should say, no, now putting people in a hospital or putting people in a state developmental center should require a waiver, not community-based services, because more people are in the community than are in the center. But it started off as a program to waive institutional care, and Medicaid was a medical model. It was based off of an illness or a disability, and so they've kept it as it is and continued to view it as a deficit-based program. Although, like I say, that is somewhat of a challenge. Okay, so what are we talking about? Background and purposes of the Home and Community-Based Services Final Rule. Okay, we want to enhance service quality. Number one issue of what the feds are saying. Let's look at how services are being provided and what can we do to make that better. Prior to the Home and Community-Based Waiver Final Rules, there were services varied all over the map. So if you went across the country or even here in California, you had everything from very segregated site-based services where the individuals were off someplace in a setting that was segregated from the general community, was on institutional grounds. It was being provided in ways that were didn't allow for individual decision making, didn't allow for access to the community, etc. All the way to the other extreme of totally community-based services, and there wasn't a uniformity of the type of services that were out there. So the Home and Community-Based Final Rules was an attempt to enhance service quality across all programs that are eligible for the Medicaid reimbursement, which is not all the programs that are provided, but a good portion of what is being provided do fall under this. Now, California, as well as the other 47 states or 46 states in the District of Columbia that are involved with this, submit a list of programs that they want to be covered under the waiver. And the federal government looks at that list and then decides which programs can be on there and which programs they say, no, we're not going to fund that. California, has over the last few years really promoted the self-determination program. Self-determination, when it was written into the California law, specifically said we will provide this vendored service for individuals, this new service and support, if the federal government allows us to get it under the Medicaid waiver, home and community-based waiver services. And it took about 3 or 4 years for California and the federal government through negotiation to come up with a plan that met that. So enhancing service quality, the home and community-based final rule focuses on improving the overall quality of community-based services for individuals with disabilities. This involves ensuring that services are person-centered. So, and if you go back and look at the actual regulations that set up the 10 rules, there's a big section in those regulations specific to person-centered planning, meaning they are tailored to the unique needs and preferences of each individual. The goal is to provide high-quality support that enhances the well-being and satisfaction of those receiving services. So what the federal government said when they came out with these rules, okay, we want to make sure that the support and services that people are getting are quality services, and they're based off that person's plan. And the other thing that were really integral to the federal changes that came about with the implementation of the home and community-based waiver services was promoting choice and integration, emphasizing providing individuals with disabilities more opportunities to make choices about their own daily lives and to participate fully in their community. This includes ensuring that they have access to community settings and activities which help to foster social inclusion and integration. Years ago, I would go out when I was working at the regional center. At one point, I was in the community services department, and we'd go out and do assessments and evaluations on ongoing day programs. And you would go out to most day programs, and they would have a specific day calendar for the individuals in their program. And there may have been 2 or 3 tracks. Sometimes people had one group that were for individuals who had more cognitive and adaptive abilities, and they would do one thing. Folks that had a moderate disability would maybe do something else. More severe or profound would maybe be involved with a different track. But so on Monday from 9 to 10, you did this. From 11 to 12, and there wasn't any choice. One of my colleagues used to talk about that as the tail wagging the dog. So here we're talking about an individual plan for everybody, but that doesn't matter what the plan says, because if you went to the ABC day program, this is what your day was going to be like. And the feds are now saying, no, we want there to be promotion of choice and integration so that the individuals that are being served have some control over their day. And ultimately, what we're trying to do is to give them full control over their day. So, the challenge sometimes is that we're a provider, we have a 1-to-6 ratio. We've developed the program design, which we've submitted to the regional center. There are all these sort of rules and regulations that we need to follow to make sure that we're in compliance with the rules. And at the same time, we want to make sure we're promoting as much choice and integration. And sometimes it is a bit of a challenge as a provider to try to do both. And that's really where you need to be creative and look at how you're providing the services. And if there is a situation that arises where you're unsure, get a hold of your liaison at Kern Regional Center and talk with them about different options. In addition, as part of both the Bakersfield ARC and the Positive Purposes grants, you can talk to us and we will try to help you as well to try to figure out how you can promote the choice and integration at the same time that you're meeting the Title 17 and other requirements that are out there, because sometimes it seems like the two aren't totally in sync with each other. Okay, some key definitions that we go by. The home and community-based services are designated to provide long-term support to individuals in their own homes or community settings rather than institutional environment. So that was really what started this whole thing. Okay, these are individuals that in many cases are going to need services over a lifetime. And as such, we want to make sure that those services occur in the community. Now, the Medicaid waiver rules, which then make somebody eligible for the home and community-based waiver, require that somebody have two significant areas of, and they still use the term deficit. So they look at the CEDAR, which is a tool that Regional Center uses to evaluate individuals' functional abilities. And you need to have two areas where there are some challenges in those abilities to be eligible. And the Regional Center has staff who just full-time review case records to make sure people have continuing eligibility. So for those folks who are on the program, they need to continue to recertify them. And as California, at least in the past, has added individuals every year, their responsibility to do that is to make sure that they've assessed somebody and certify them for the program. So Regional Center has got a responsibility to certify that someone is eligible indeed for the Medicaid waiver services and the home and community-based services. Again, what is happening at the federal level with the budget bill that recently passed and the cuts that we're going to be seeing in Medicaid services, that's sort of an unknown. You hear, again, different people telling you different things, and I would suggest that you stay tuned. For those of you who are interested in more of this, there are I would suggest getting online and going to some of the advocacy groups and getting on their newsletters. The California ARC, which Bakersfield ARC is part of, has a Monday memo every week that they put out news of what's going on. The Association of Regional Center Agencies, which is ARCA, puts out a weekly newsletter on things. There are some other sources that keep you posted on some of the changes both at the state level and the federal level. So if it's something that you're interested in, and I know not everybody is, I happen to be one of those that are, you can find that. Now, when we talk about waiver is not a program that is unique to persons with intellectual and developmental disability. The waiver also provides senior services. There is a waiver specifically for HIV/AIDS. There's a waiver for elderly. There's a waiver for mental health. So there are a number of different waiver programs. So when I showed that slide earlier, it said at least 47 states have one or more waivers. Some of those states have, like California has taken advantage of all of the waiver programs that they can apply for, and I think is providing 6 or 7 waiver programs. One of those being for individuals who have intellectual and developmental disabilities. Now, intellectual and developmental disabilities varies from state to state and at the federal level. So California, as part of its submission to the federal government saying this is who we want to serve, had to come up with a definition of what is a developmental disability. And if you go back and look at Title 17, the California Code of Regulation, it says a developmental disability means a disability that is attributable to intellectual disability, cerebral palsy, epilepsy, autism, or disabling conditions found to be closely related to intellectual disability or to require treatment similar to that required for an individual with an intellectual disability. So there are basically 5 categories that get somebody services for the regional center. They have to originate before the age of 18. They have to be likely to continue throughout the person's life, and they constitute a substantial disability. And if you go into the regulations a little bit further, it spells out what a substantial disability is. Now, interesting enough, if you go to the federal rules, so what does the federal government say is a developmental disability? It says originates before the age of 22. So that's a difference. It also uses a definition of functional disability rather than substantial disability. So there are some differences. Other states use different definitions. Most of them are fairly similar, but some of the language can be a little different from state to state. And again, this is the definition for the state of California. Okay, again, the Center for Medicare and Medicaid Services are the ones who are providing these services. Interesting enough, for those of you who watch afternoon TV, Dr. Oz, who was for many years television spokesperson, is now the head of the Center for Medicare and Medicaid Services. HCBS are long-term services and supports provided in the home and community-based settings as recognized under the Medicaid, and in California it's called Medi-Cal program. These services can be a combination of standard medical services. So some of the services can be related directly to doctors, therapists, hospitals, outpatient clinics, etc., and non-medical services. Standard services can include, but not limited to, case management. So the regional center receives funding for the case management that they do for those individuals who are on the waiver services, supports and service coordination. They have a system over there. They call it Title or 19 of all the documentation that they do on the case record gets billed back to the federal government. Homemaker services, home health aid, personal care, adult day health services, habilitation, both day and residential. So adult day health services are different than day and residential services. Adult day health care, there are a number of those here in Bakersfield. That bills directly to Medi-Cal, and the services that you provide get billed through the regional center, purchase of service, and then the regional center then submits that back to the Department of Developmental Services, and then they bill the federal government for 50 cents on a dollar. So it's a little different way of doing things. And respite care. The states can also propose other types of services that may assist in diverting or transitioning individuals from institutional settings to their own home. So California has a whole list of services that they have submitted to the federal government and received approval for. And those get renewed every 3 to 5 years. So the federal government comes out and California has to reapply and takes a look. And sometimes during the interim between the previous approval and the new approval, if some new service comes out that California believes would be beneficial to the population that we serve, they can submit basically a change proposal to the federal government to ask that a additional service be provided under the waiver program. Home and community-based services provide opportunities for Medicaid beneficiaries to receive services in their own home and communities rather than institution or other isolated settings. So we've gone over that a couple times now. These programs serve a variety of targeted groups, and as I mentioned a few minutes ago, older adults, people with intellectual or developmental disabilities, physical disabilities, mental health, and substance abuse disorders. So there are a number of waivers here in California. We are working specifically with the one which is for intellectual and developmental disabilities. If you look at, this is from 2021, this is the latest statistics I could find, that 86.2% of persons and this is nationally, of long-term services and supports receive home and community-based services. So of the people that are receiving long-term supports, which is what the services and supports that you are providing are considered to be long-term. A person's going to need it for some time. So every year we're developing the plan, but we're also looking at long-range goals, and we're going to continue to serve that individual. About 86.2% of those individuals received home and community-based services. And of the money that was being spent on long-term care, about 63.2 cents on a dollar came from home and community-based services. Most of the rest of those dollars were state money, so that the state taxes that you pay were here in California, we're paying for out of the general fund, they call it the general state fund, paid for the difference, the other 37% of the services that individuals received. Again, this is from 2021. Okay, so regulatory context and implementation timelines. The home and community-based rule aims to enhance service settings to improve quality and person-centered care. Now, the current home and community-based final rules came out in 2014. And that came out after a series of public hearings, of proposed drafts, of public comment. So it was out there for a couple of years before 2014 in its development. 2014, it was finalized in March of that year, and it was to be phased in over a 5-year period. So the federal government said, okay, so we're going to, everybody has to be in full compliance by 2019. Over the next few years, the state were submitting letters to the federal government asking for clarification, and the federal government continued to put out clarification as to what these rules mean and examples. So, for example, what constitutes a segregated setting? So, let's say a program was site-based, and they ran both a residential and a day program, and they were out in a rural community. So they were outside of the urban area. They sort of maybe a little bit more isolated. Did that constitute a rural setting that was required a higher level of scrutiny by the waiver evaluators, or could that pass muster for being a setting under the home and community-based waiver? A number of other things were challenged or looked at over that period of time. Well, in 2017, with the change in administration in Washington, D.C., with the first term of President Trump, his Health and Human Services Secretary looked at the regulations and looked at public comment and some of the things that were coming in from the states and said, wait a minute, I don't think the states are going to be in full compliance in the next 2 years. So it is 2017. Regulations came out in 2014, 2017, 3 years into the change. The federal government said, no, it's going to take longer. And so they changed the compliance deadline to be 2021, March of 2021. Well, in early 2020, we got a new challenge, and that was the COVID-19 epidemic, which really significantly changed the way we were providing services to and supports to individuals. And that, as more and more programs were doing remote services, or some programs just shut down, or other changes that were being made, the federal government then came out and said, okay, we're going to extend it once again. So now we're talking 2023. So we went from initially new rules coming out in 2014, which were going to be implemented in 2019, to 2021, then 2023. Well, in California, it took a little longer. Initially, California had every provider complete a self-assessment evaluation as to where they were with that. And Regional Center spent a great deal of time assisting providers with those, and sending back the evaluation sometimes. Hey, we need more clarification here. You didn't really address this. We need, here's the, you sort of missed the concept. Here's what we really need. And sure enough, we were able to get everybody's self-assessment done by the deadline. Well, then the feds reviewed that and said, well, no, we don't think that's enough. We think that somebody needs to go out and actually eyeball these services to make sure that what's being provided is the quality services that we, are looking for under the 10 rules. So California had to go back and look at a plan of how they were going to assess every residential facility, every day program, every vocational service that fell under the home and community-based waiver, and any other service that fell under it also needed to be potentially assessed. And that was a pretty tight timeline, and California had asked for an extension, which it received from the federal government. So California finally came into full compliance in 2024. So 10 years after the home and community-based waiver final rules came out, we really had compliance. Now we're, as I mentioned earlier, we're looking at how do we make sure that we are continuing to be in compliance, that we're not backsliding, we're not going back to traditional type service models from 10, 15 years ago, that people are interpreting the rules as they were intended and are actually providing a quality service, and that individuals are being fully involved in their communities and are decision makers, and that plans are individualized for each individual. Okay, core principles of the final rules. As we mentioned earlier, and I did last week, my presentation was on person-centered type services. Planning focus on respecting and incorporating each person's unique preferences to enhance satisfaction and outcomes. Empowering through choice, encouraging individuals with IDE to make choices, empowering them to direct their own care and supports. And services are designed around personal goals to ensure meaningful and effective supports. Recently, I went out to a program was looking at what was going on, and we were talking about for individuals who were involved in their day services. Well, what if, as part of that annual meeting, and we were discussing the possibility that Joanne would move from being in the day program to being part-time in a work setting, or be in, or move towards being in a work setting. And the facility, the day program said, "Oh yeah, we have a work program, and we'll just move Joanne over a couple days a week initially, and we'll start her getting going." And I said, "Well, we need to back up a minute here. If we're talking about empowerment through choice, did we sit down with Joanne and say, would you like to continue with this provider to provide the continuum towards work? Or do we want to take a look at other providers and what is out there and what's available? And then you can make your choice." So that's part of individual preference, because everybody is unique. The plans we develop are unique for that individual, and how we go about that. Now, one of the things that I oftentimes hear is, okay, this is great if you have an individual who is fairly verbal, who has some a more understanding of what's available out in the community, and sort of has some ideas of what they would really like. But at this program, we're working with individuals whose functional skills, whose verbal capacity, whose other challenges make it difficult for them to really speak up and to be an active participant in the planning process. And you got to take a step back and look at, wait a minute, there are all kinds of ways that people communicate, and it's not always verbal. And if you've been working with someone for a year or two, you sort of know what their likes and dislikes are. I sometimes joke, and some of you may have heard this before, but I say that there's basically two types of behavior. Either you're trying to get something, or you're trying to get away from something. So if you see that this individual really seems to enjoy, is much more engaged, is more active, their mood, their facial expressions, their animation, it tends to be different, as there are different activities that are provided for that individual. That's a pretty good indicator of what likes and dislikes are. In addition, trying new things. So in the planning process, adding some services or supports that haven't been traditionally tried with this individual, and then seeing how they respond to that. And is this something that they like and enjoy and seem to want to participate in? Or are they sort of pulling back and letting you know that that is not an activity or event or a community setting that they really would like to be in? So person-centered planning has a number of facets, and you need to be respectful of looking at that. In addition, if there's family involved, or other supports, or people in the community who really are part of this person's life, involving them and having them help in defining that person and what their strengths are, and what really would be a good program for that individual. Okay. This month's newsletter, if you got it or seen it, really talks about integration and inclusion. and they're not necessarily the same thing. I sometimes go out to shopping, and I may see, if I go to the Valley Plaza or to the Riverwalk or wherever, a group of 6 clients and a staff person walking through that shopping area. Now, many providers have shared with me, well, that's part of our community integration program. Well, who are they interacting with? So when that individual is walking through the mall, is it just that they're walking through, or maybe they're going into a store, or are they doing something meaningful that has that can provide for some inclusion? So if we're going to the mall per se, what's our goal for the day? Is it just to walk from Penny's to Target? Is it to or is it to really look at uh, things that a typical individual might do if they go to the mall? So, where do you shop for jeans? What stores would we go to? How do we select what we like and what we don't like? Um, if we're involved with a pre-vocational program, let's say, what, what do we go into the store and maybe talk to the manager about what's involved in applying for a job and what that job would entail, and maybe spending a few minutes, talking with staff or watching what the staff are doing and getting some idea of what employment is. If we're going to the food court, is the DSP ordering the food for that individual, or is that individual being encouraged and challenged to order for themselves and to use money appropriately, to make change, to do other things to express their preference of what they would like to eat. So we want to try to do that. Example of full inclusion might be if Joan shares that she likes sewing, and we look and find that north of the river, Recreation has a class, an advanced sewing class or a beginning sewing class that meets on Tuesdays from 10 to 12. Maybe we can figure out a way to get our individual to that program, and she can then become part of that group and get to meet and talk with and become friends with other people in that sewing group. A number of years ago, or some of you may have heard the story before, when I was involved with the Bakersfield Exchange Club, which is a service organization here in town. I talked to my fellow members, and they all agreed, and we actually got an individual who was involved with vocational services at Bakersfield ARC, and he would come to our weekly meeting, was a full participating member of the organization. We did a lot of charitable work, and he would show up at all of the charitable events that we did, and was a full member of our organization. And that's what we want to try to encourage. That's full inclusion. So, when I'm going out to run errands and I talk to my wife, I don't say, well, I'm going out into the community now. Which is, I go to programs and I say, oh yeah, today's our day for a community outing. We're going out into the community. I'll say I'm going to PetSmart to pick up dog food for our dog. I'm going to go to the grocery store to pick up some vegetables. I'm going to stop at the gym before I do that. And these are the 3 or 4 activities that I'm going to be doing in the community today. So I'm not going out in the community, I'm doing meaningful things to enhance the quality of my life. And that's what we want to promote. Um, okay, a biggie is protection of privacy. Um, you and I like our privacy. You know, we don't particularly want people involved in things that we don't want to share. And yet, historically, that's not been the case for the people we serve, that their most intimate details are often discussed. I um, remember going to an IPP one time and the staff were talking about this individual's inability to adequately wipe their behind when they had a bowel movement. And this became part of the discussion at this IPP meeting, and they were talking about this individual in third person. He doesn't do this. This is a problem. The staff have to go into the restroom or be with him in the restroom to make sure that he completes this task, and then we need to make sure he washes his hands. And it's a private occurrence that you and I wouldn't want to talk about. And a matter of fact, Michael Small, who is one of the founders of person-centered planning, has an exercise, and it's something that if you want to try, you can do this with your staff. Ask them, okay, tell me everything you did this morning before you came to work. And people will tell you that they got up, they showered, they got the kids ready, they took a chicken out of the freezer for tonight's dinner. They looked at Channel 17 News. They took the kids to school. Then they came into the office. Well, he sometimes would joke and say, well, we must be the most constipated nation in the world because nobody went to the bathroom. And the point being is that we don't talk about that. It's not, I got up this morning, made, number one, did number two, this and that. Not part of the discussion. And so for the people we serve, that should be true. And in residential settings, that privacy extends to it's their room. And now the requirement is that there needs to be a lock on that door and that they have a key. Some providers have said, well, clients or individuals tend to lose their keys, and we've gone to a combination lock, or we've gone to other types of setting. Well, as long as there's privacy, and if the staff have the key, it should be a designated staff, and it shouldn't be used unless it's absolutely necessary. So because we want to respect individuals' dignity. One of the challenges that we have for those individuals who need a lot of assistance with self-care, bathing, grooming, dressing, toileting, the high level of staff turnover that we see in many programs, which again, if we're talking about respecting the individual's privacy, and last week it was John that was assisting Billy, and this week it's George that's assisting Billy. It's kind of disconcerting for Billy because he doesn't get the same person with regularity assisting him with his private functioning. We want to ensure autonomy, that people's wishes are respected, and where possible, fully implemented. Now there are times where we have to work with a group of 6, and the group is going to do an activity, and maybe somebody would rather do some other activity, and then we need to negotiate and try to figure out ways of doing what they want as well as the others want, and maybe taking turns or doing other things. But as a goal, we want to make sure that we are ensuring that people's autonomies are maintained. And then freedom from coercion and restraints. You can't The example that I've used before is that I remember going out to a facility and the client told me that they would never want to leave this residential care facility because the provider bought them a new pair of tennis shoes, and no other provider would ever buy them another pair because the provider told them that they're lucky to be here because if they were somewhere else they wouldn't have gotten those tennis shoes. And that's kind of like may or may not be the case. And that's not something you would share with a client. Another example is like a client made a complaint about something that the staff did to their service coordinator. Service coordinator then talked to the facility manager. Uh, Next time the service coordinator came out, the individual said, "You got me in trouble." Really? How? Well, the staff said that you complained and now they don't want to talk to me or they don't want to help me or they don't. And that's retaliation. We can't really have that either. We need to make sure that clients are free to make choices, to speak up, that they have the same whistleblower protections that you have as an employee of your particular agency, that the regional center has in terms of the services that they provide. So we want to make sure that people have that freedom. Okay, requirements for setting, providing services, uh, community integration. We've talked about that, and that we need to make sure that the services that we're providing are in the broader community. And so just field trips out on Tuesday or going to the movies, going to the Mind Theater for a Wednesday matinee is not community integration. Individual choice. So when we're sitting down and making the schedule for the week, for the month, for this group of 6, how are we taking into consideration the individuals? If this is a residential setting, what are we doing to in terms of the menu, for example, or the activities that we're going to be doing on the weekends or in the evenings, and how do we incorporate that for everybody who's residing in that home? Individual choice, providing meaningful choices, and meaningful choices a lot of times means that we have to give people an opportunity to try new things. So we need to explore with folks opportunity. So if someone only knows certain stores or certain activities, and when you ask them what they would like to do, they say, I want to go to the Walmart, or I want to go to miniature golf. And because that's what they know, we want to try to expose them to other things. Well, let's look at what are some other stores that maybe can provide that what you need or where you want to go. What are some other activities? Have you ever been bowling before? Have you ever gone, let's say, out to a museum to take a look at that? Have you been out to the to the zoo? What are some other activities that we can do or that you can try and see if, and then we can get back and see if you like them or don't like them. So we give people. So then later on, when we sit down with that individual and say, okay, what choices would you like to make? It's not the 3 or 4 that they know. It's now 8 or 10 or 12 choices. We had at Bakersfield ARC, we worked with Employers Training Resource to do a class on different, basically a work 101 class, this introduction to work settings. And I was talking to one of the individuals who went to the class, and he said, I never knew that there were that many jobs out there. And what he was telling me is he knew what his parents did and his grandpa and grandma did, and maybe his aunt and uncle, but he didn't know what anybody else did, or he knew what the people at the store did, but he didn't have that in his repertoire to know that there are many, many other types of jobs out there, and there were potentially choices when he sat down with his team and they wanted to look at, is vocational services an option for this individual? He'd have more information to choose from. And then quality of life. we want that the quality of people's lives to be similar to yours and my quality of life. Now, some of you have probably heard this before, but there are individuals out there who the only adults that they run into or have communication or interaction with during the day who aren't other individuals receiving services are people who are paid to be with them. So if you live in a residential home and go to a day program, the staff at the residential care home you interact with in the morning, you get on the express transportation bus, which then takes you to your program, and the staff on the bus, the driver is paid. Then you get to the program, the staff there, the direct support professionals that you're working with, and then back to home via the bus and then back home again. So everyone in that environment is paid to be with you. It's not like think about yourself, your neighbors, your friends, your fellow congregates from church, that Wednesday night poker game that you go to, the different activities that you do because you like people and you're friends with them, that you share an activity. Those are the same sort of things that we want for the people that we serve. So it's not all about a sort of regimented from the time they get up to the time they go to bed with staff throughout that interactions. We want to try to get those individuals without disabilities into their lives and be part of the community in some ways. Okay, there are restrictions under the home and community-based waiver services. It can't be like an institution. So if, say, for example, the day program or the residential facility are on a hospital ground, that's not something we would allow for. What I was mentioning earlier about maybe the setting is an enclosed setting, got a fence around it. It's out in a rural part of Kern County and they provide, it's all inclusive. People live at that setting and they receive their programming at that setting. That would not fall under the waiver rules because those would be considered isolated settings. And there is a criteria that the assessor uses to decide whether something meets that criteria of an isolated setting. So if you're at all interested in that, you get a hold of Leslie or myself and we can share that with you. But I don't think any of you fall under that. And the rule aims to eliminate care settings that limit personal autonomy and freedom. So we want to make sure that we are giving people choices and doing that individual plan. And then when we're providing the services to them and the supports, that they're involved in deciding what those services supports are. Okay, for compliance, providers must establish and follow policies that align with the regulations, rules to maintain compliance. So you all have to have a set of facility rules. There's also or somebody in your administration has developed a program design that's submitted to the regional center and has been approved, and that's the way you're supposed to be providing your service model. Home and community-based waiver services require staff training to make sure that people are in compliance with these new rules. One of the challenges that I ran across when I was working at Bakersfield ARC and we started making the changes, we did some staff training. We did a fair amount of staff training on, wait a minute, this is the kind of like what we're talking about today. These are the new directions that we want to go in. This is how we're going to be providing services. This is what we mean by inclusion and what have you. But then when the time came to start, what we did was when we brought people back into the setting from being providing services remotely and going out like one-on-one. We used to call them porch visits. We never went back to the setting. We just started doing the services out in the community. So when we started bringing back our 1-to-6 ratios, we immediately went out into the community. Well, even though we had done a good deal of staff training, that didn't mean that there wasn't still some, what are we doing this for? Why are we making these changes? This doesn't make sense. What happens when we're out in the community and one of the individuals tells me they need to go to the bathroom and maybe they need a little bit of assistance, but I got these 5 other clients, and how do I do this? And what's going on here and there? And what if the one individual says they don't want to do what the activity is? And all these things came up. And it's something that it's important to continually do staff training to make sure people fully understand how to go about making these changes and continually enhancing what you're doing. And then you need to have documentation. You need to be able to show that you are indeed respecting that individual's autonomy and personal freedoms and enhancing the quality of their life and providing them with opportunities in the community. So that would be basically both your service plan, your ongoing service plans that you're writing that are reviewed quarterly with the regional center, and also any ID notes that you're doing. So on a daily basis or on a regular basis, as you're doing your ID notes, kind of like here's an example over here on the where it's a checklist, but there are different ways and different places are doing it. Some are now going towards a computerized file, and so all the notes and everything else are done, electronically, either on an iPad. It can be done from a phone, can be done, on a computer. A lot of different ways of doing it. Encourage you if you're looking at the direction of going automated. It really does make things easier for staff because somebody can be out and about and be doing notes even on their smartphone. So, anyways, something to think about. Okay, impact on individuals, providers, and systems. Okay, so for the individual, it means improved quality of their life, that they're able to overall well-being, satisfaction. That the more that people are involved in making decisions for themselves, and the more that they feel that they have some freedom of choice, the happier they are. Think about it. If you get told all the time what you were going to be doing and where you're going and how you're going to be doing it, and whether you're doing it right or not, it would not be a good existence. And then increasing independence. We want to try to make it so that people can do more for themselves and have more control over their daily lives. And then community participation. And again, what a typical individual does in the community is what we'd like to see our individuals doing in the community. And ongoing personal growth, giving people more opportunities to try out things and do things in the community. Challenges that we see. Providers encourage difficulty adapting the service model and changing needs effectively, like I was mentioning when we did it at Bakersfield ARC. We found things that we didn't think about when we first started thinking, well, this is going to be a cakewalk. We're just going to move out in the community and it's all going to be right with the world. And what we found was no, that if you're going to be giving people more opportunities and you're going to be entirely based in the community and providing the services away from a site or doing things, how do you do that? And how do you maintain the supervision necessary? And how do you give the people the choices and other things? So you really do. There are challenges with that adaptation of services. And again, Title 17 and Title 22 sometimes can get in the way in terms of what they say and what some of this says are not entirely compatible. And again, that individual program design that the IPP, that's person-centered. If there are times when this person will go off without the supervision of the group or be involved with activities in the community, note it in their plan. That this is something that the team reviewed, and it was how we decided we were going to do things. And then it takes on a level of authority to be able to add that to that person's life. And then, yeah, as we mentioned earlier, person-centered, person care. Okay, California they play a key role in changing and executing the home and community-based waiver. So California has developed the plan, submitted it to the federal government, to the Center for Medicaid and Medicare Services, and based on the approval of that plan, they then go back to the regional center, send out memos and directives, and then the regional center then goes out to you all and says, okay, this is how we need to do this, and this is how we're going to assess you to make sure that you're doing it. And so that the oversight responsibility, although it belongs to the state, really gets done through the monitoring that Kern Regional Center does of your programs. So, rules are out there. These are what you need to follow. And these are the folks that are going to kind of come in behind to make sure that you are indeed following these rules and are in compliance. And then if you're not in compliance, there's rules. I mean, in 2024, when we did the assessments, if somebody wasn't in compliance, they got a 30-day ability to become in compliance. If they didn't, it started ratcheting up, and then it could go all the way to the point of losing funding or having clients being relocated. And so it's taken very seriously. And the new directive that will be coming out with DDS for 2026 will have things like that in there again. This is how you can become in compliance. This is how you continue to be in compliance. And these are the potential sanctions. And it will list those out and timelines for those if you're not in compliance. So, we don't know what specifically those will be yet. But if you go back to what they were in 2024, somebody could potentially have lost their livelihood in terms of providing these services if they didn't come into compliance. And that's how serious this is reviewed. It's kind of like being on another type of employment and not following the rules of that employment. And the employer says, hey, we can't have you working here anymore because you're not doing what this company needs you to do. And so that's how this is looked at as well by the federal government and implemented through California. Okay, moving forward, strategics for successful implementation. Collaboration is important. The fact that you're on this webinar today means that you care about this stuff and you want to do a better job. Continually ongoing training. These trainings and other trainings that are provided by Regional Center. As I mentioned, if you're not receiving my newsletter, do talk to Irene and get on the list. And I will put in their trainings that are occurring in the community. And some of them are unique to California. Some of them are national trainings. And the interesting thing about national trainings is if you get on any of those, you get to see some of the differences between the way we're doing it here in California and the way other states and how the federal government, their expectations on how things are doing. Continue to think in terms of person-centered. How am I doing this based off of the needs of this individual and not necessarily the needs of my home or the needs of the program that we do. And you want to be flexible. You want to promote change and do things differently and try things out and give individuals the opportunity to do new things. And then if they work, they work. If they don't, they don't. I mean, I've been to, I like trying new restaurants, for example. Go someplace and say, oh, I'm never going back there again. The service, the food, the waitress, whatever, was such that not going to happen. Or could be, I thought that was the most wonderful thing ever, and I'm sure I'm going to include this in the places that I go out to in the future. So we want that flexibility so people can really make those choices about what they want to do. Regular monitoring, again, you want to monitor your own services. How are things going? If you're a supervisor, what's going on with the people that you're working with? Are they doing what they're supposed to be doing? And how is that affecting the individuals? Is this individual? So is Samuel, now we're looking at him over the last year, how much greater is his independence? How much more is he involved in activities that are fully integrated in the community? How many new things has he really had the opportunity to try? You want to make sure your reporting is transparent, that when you're writing up case notes, and you're writing up your quarterlies, your annuals, that what you're submitting to the regional center is basically what's going on with that individual, and it's accountable, and you're showing that how the services are being provided, and you're looking at continuous improvement. How can I do this better? Hey, I took this class from Jeffrey on Wednesday, and he mentioned this and this and this. And so, you know what? We're going to take our group out to a new setting this next week that we haven't been to before to find out whether they particularly like that or not. And how is a way we can get them to meet and interact with people who are not clients of the system during the week to see to really enhance their community skills. And finally, resources for ongoing education and support, federal education resources. If you go on the Center for CMS's site, HHS, Health and Human Services, there are other sites that are out there. If you go to the DDS website, there's information, and there are other sources. And again, my newsletter will also provide you with sources where you can find more information about this. And stay tuned, because through these training grants, there'll be more opportunities as well. Okay, conclusion, any questions? If you would like, you can open up your mic and ask or speak up. Okay, well, thank you all for participating today, and hopefully this was helpful. And again, starting next month, there will be the one training on most likely the third Wednesday at 10 a.m. So stay tuned. It'll be posted in the next newsletter. Take care and have a good rest of the day.
Thank you, Jeff. I appreciate it.